Let us briefly talk about what is PRP. I'm sure you have heard a lot on the net and in social media regarding PRP and it being touted as a surefire method or a surefire treatment for a lot of conditions. A short form for platelet rich plasma. So what is platelet rich plasma? Platelets are a type of cell which is present in the blood, and these are also called thrombocytes, and these are the cells in the blood which are responsible to cause clotting whenever you get an injury. In layman's terms, so when you have a cut, these are the first cells which come in, collect at that point and seal the cut and stop the bleeding from occurring. So once these get stuck there, then they release growth factors, and these growth factors attract other cells which come in there and which informs them that there is an injury here, and they come and they help in the repair of that area and to close the seal. And this is the regeneration, or this is the regenerative capacity of the platelets that we are harnessing when we are using the PRP. So what exactly is involved in PRP? As I mentioned before, PRP is basically a collection of your platelets. We concentrate, we take your blood, we draw your blood from your hand, it is collected in a tube, we centrifuge it, we take out the platelets, and those platelets which are taken out are suspended in the fluid part of the blood which is called plasma. So that's why it's called platelet rich plasma. So once this isolation is done, then you can activate the platelets and then you inject it into the areas that it is required. So the activation of the platelets causes release of some growth factors. There are a lot of growth factors and various cytokines which are released from the platelets, and all these growth factors cause various effects in the surrounding areas which promote rejuvenation or promote regeneration. PRP in skin helps in rejuvenating the skin, it helps in improving collagen deposition there, and it helps in bringing more vascularity there or creating new blood vessels, and because of this it helps in the overall rejuvenation of the skin. It helps in neocollagenesis, and that is why it can be used in stretch marks and in aged skin. It helps in bringing microcirculation, it improves microcirculation, so that is why it improves the general outlook of the skin. And these are the factors that are used when you are doing the PRP into the skin. Vampire Facelift is something that you must have heard about on the social media, and a lot of people come asking for it as to we need the Vampire Facelift. So the Vampire Facelift is basically a combination of the PRP along with hyaluronic acid fillers. So the concept is the vampire term comes in because of the PRP that we are using, and we are going to inject or do a microneedling to apply the PRP for it. So that helps you with the rejuvenation, taking care of the fine wrinkles, taking care of the glow on the skin, and general collagen regeneration. And the lift actually comes from the volume that is added because of the fillers. So if you're doing a non-surgical facelift, which is basically fillers in different areas, you can combine it with the PRP, so that will help you with the collagen regeneration along with the hyaluronic acid fillers. And you can even dilute the hyaluronic acid with the PRP and inject it all over the face, so that gives you a more hydration effect also. So the combination of fillers along with the platelet-rich plasma, or the PRP therapy, is commonly known as the vampire facelift. PRP in hair is used for some specific indications, and it is effective in both men and women, and it is helpful in alopecia, and it's helpful in the alopecia of men, which is basically hormone related, and of course even in alopecia areata or in alopecia in women. It works by rejuvenating the hair follicles which are dormant and then thereby stimulating them to grow new hair. It improves the vascularity, and because of which the width of the hair grows, the shaft grows a little wider, and it also increases the anagen phase, which is basically the growth phase or the youthful phase of the hair. It prolongs that so that the hair stays longer and doesn't fall. So these are the main indications because of which you are using PRP on it. So the next question is, how long do we use the PRP for? So my simple answer to that is that because it is just rejuvenating which is happening there, as long as you keep rejuvenating, the hair follicles stay that way. Once you stop it, then the hair will go back to how it normally is. So what we normally do, everybody does has a varied protocol on how to use the PRP, and normally we use it subsequently in succession for a few weeks or a few months to see how the initial response is, and once the response is achieved, then you have to do sequential PRPs in between with a gap of 3 to 6 months in between. That will help to keep the rejuvenation process going on. So for example, you would do once a month for about 3 or 4 months, and then after a gap of 3 months, and then maybe once in 3-4 months or 6 months, you can keep doing the PRP to keep the rejuvenation. A point to be noted here is that you do not grow new hair. So if you think that PRP is going to grow hair where you didn't have hair, then that is highly unlikely, because once the follicles are dead and gone, they cannot be rejuvenated, you cannot resurrect them. But the remaining follicles or the hair that you have, if they are dormant or if the telogen phase is too long, or then the PRP will help, and it will help rejuvenate the follicles and rejuvenate the follicles to grow new hair. Along with it, because of it also increases the vascularity of the area, and that is why your hair follicles and the hair width of the hair or the hair shaft grows thicker. This hair grows more lustrous and longer, and so the quality of hair also changes. And then along with it, the anagen phase, which is basically the growth phase of the hair. There are 4 phases of hair growth, which is a cycle like the life cycle of a human being. So the anagen phase is like the younger age where they are growing and thriving and showing up thicker and more lustrous. So the anagen phase is prolonged, so that even if you have an anagen phase of the hair cycle which keeps going around, the PRP helps with the prolongation of the anagen phase, so the hair continues to stay younger and thicker and stronger for a longer period of time, and that is how the PRP helps in hair. What are the other indications of PRP? PRP, as I mentioned, most commonly is used for the facial rejuvenation or skin rejuvenation, along with hair rejuvenation or hair fall treatment, medical treatment of hair fall. So what are the other areas that is being used? It's used extensively in orthopedics, again where it is used for joint pains, it's used for neck pains, it's used for any chronic conditions which are not showing any improvement. And the basic premise being that because the rejuvenating factors are there, so they will help try and repair the area. Along with that, it is also used in dentistry. It is extensively used for non-healing ulcers and diabetic foots and neuropathies and chronic non-healing ulcers. So anywhere where there is a lack of vascularity or a lack of collagen, you can use that, and it can help you with the regeneration and the repair. Some other indications are it's used in vaginal atrophy, and it's also used for G-spot amplification. It is used as a treatment for erectile dysfunction, where the injections are directly given into the shaft of the penis. So there are various indications which are it is being used for, mainly because it's your own blood and it doesn't cause any major issues. But from the treatment point of view, verifiable treatments where it has worked and it has shown good results are still for skin, hair, and some orthopedic problems, and of course for dental treatments as well. So what does one need to know about PRP therapy is that yes, it's more or less it can be done for anybody. You don't need any specific indication for it because it's your own blood that is being used, and as long as you're medically fit and you don't have any other medical problems underlying which are causing problems with platelet dysfunction, then it can be used, and it doesn't cause any reactions because it's your own blood. And yes, it does have, because it's being injected into certain areas, so you will still have that downtime of 2 to 3 days time, but apart from that there are no major contraindications to doing a PRP on you.